Hello, this is Margie Meady, and I'm recording the PowerPoint, the nursing process in psychiatric mental health nursing, just going over how you use the nursing process in this specialty field of nursing. So just to review, the nursing process is a systematic framework for how we deliver nursing care to use a problem-solving approach that is goal-directed and has the underlying objective of making sure that our client care has quality and structure to it. It is a very dynamic process. It's not static, meaning it's ever changing and evolving to meet the needs of the client, and that this process is inherently able to adapt and change as the needs of the client adapt and change. So this slide just shows that the standards of practice for psychiatric nursing were actually written around the 6 steps of the nursing process. So as we go through the different PowerPoints that cover the disorders and conditions that we're going to review in this semester for psychiatric nursing, you'll see that as we discuss them, that we follow this nursing process when we're looking at how we're assessing the client, how we're coming up with nursing diagnoses that would be pertinent to those conditions, and we come up with outcomes that are the specific goals that we think could help with keeping that client healthy or moving toward a resolution of an outcome or just improving their quality of life. The outcomes are based on the nursing outcomes classification, which is a standard classification. It's a complete list of outcomes that have been developed to evaluate the effectiveness of nursing interventions. And then when we're planning those nursing interventions, we use the nursing interventions classification. That's that comprehensive standardized language that describes the specific treatments, and that can be used in all settings and all specialties. Keep in mind that the nursing interventions classifications are based on research and they do reflect current clinical practice. As far as implementation goes, these are the interventions that we select when we're planning our care, and we have specific interventions that are typically utilized in the psychiatric mental health area, and those interventions include coordination of care, health teaching and health promotion, milieu therapy that provides and maintains a safe therapeutic environment for the client. And then some nurses will become advanced practitioners, and they will have other interventions that they could incorporate when they're caring for these patients by the fact that they have prescriptive authority and treatment. They can prescribe treatments as well as medications, and that's done in accordance with state and federal laws and regulations. That means they can also provide psychotherapy for individuals, couples, groups, and families, and they do that psychotherapy by using evidence-based psychotherapeutic frameworks and utilizing the nurse-patient therapeutic relationships that we've talked about in another PowerPoint. They can also make consultations to influence the identified plan by enhancing the abilities of other clinicians to provide services for patients and affect change, so they are able to initiate those consults. They can, and then in the evaluation phase of the nursing process, we're determining whether the interventions have been successful in meeting the outcome criteria that we're going to measure. So you'll see that we'll use this nursing process. You'll see this come up in every PowerPoint that we talk about different conditions, and we'll talk about what's involved with the assessment of a patient with this condition, what's involved, what are the potential nursing diagnoses that this particular condition would be appropriate for this one, what kind of outcomes are we going to expect for this type of a condition, the client, what would we expect them to be able to achieve, and what would be the interventions we would plan, and then how would we implement those interventions, and how would we evaluate whether we've achieved the goal. So we'll use this process throughout the whole semester, and this is just an overview of it in this particular PowerPoint lecture. This is just a simple overview of why we use the nursing diagnosis. We began using it in 1973 with the first National Conference on Nursing Diagnosis. It came up with both general and specialty standards that are written around the 6 steps of the nursing process, and part of that is nursing diagnosis. That's one of the steps. And remember that nursing diagnoses are not the same as medical diagnoses. So just keep that in mind. And it's defined in most state nursing practice acts as a legal responsibility of nursing, meaning that it is expected that nursing practice utilizes the nursing process. And it also is very notable that it promotes research in nursing. Case management is a health delivery process where the goals are to provide quality health care, decrease fragmentation, and enhance the client's quality of life and contain costs. So what this means is that there's a process to deciding how the patient will be ensured that their health care has quality to it, that it's not fragmented, that it's a whole package that addresses all of the complete needs that the patient might need. So it's a way to ensure that all of the needs of the patient are met using collaborative interventions of other disciplines as well. So it's a way to look at the client's needs in a holistic way and use the nursing process in this management. It does enhance their quality of life, and it contains costs because there's not duplication of effort, and again, it's not fragmented, so the client gets the best benefit of this process, this way of achieving the goals and looking at things completely and comprehensively. Things aren't missed, and so we don't have setbacks. We just continue to move forward for the best results for the patient. It's a way that we're trying to control the balance between cost and quality of care. So we're giving them care that's based on their needs, and we determine that the coordinators that are providing this care determine what the needs are and how to best achieve them. So we do consider costs, but we also look at what the client needs. There's usually a case manager that's responsible for negotiating with the different providers that would obtain the services for the client. So for example, the case manager might initiate a referral or ask the dietitian to be involved with planning a diet for a patient that needs to have that be part of their plan of care. Or they might initiate the evaluation of a physical therapist or an occupational therapist, but the case manager would be the one that would be kind of the one that would organize and keep track of everything that was being put in place for a particular client. So they're kind of like the hub, the one that's keeping all of these things balanced and considered and being part of the comprehensive plan. Critical pathways of care are the tools that we use to provide in a case management system. So they're abbreviated plans of care that we have outcome-based guidelines to achieve certain goals within a certain length of time. And that helps us know that we're on track with meeting the needs of a client, or whether we're off track and maybe we need to reconsider how we're planning this care if we're not achieving goals that we know should be achieved in a certain period of time. All of the people on the interdisciplinary team use those CPCs, and they determine which categories of care will be provided and who's going to do them and by what date. Nurses are often identified as case managers, and they're ultimately responsible for ensuring that those goals are achieved within that designated time dimension. So they often are the ones making a phone call and saying, well, it doesn't look like the client met this goal to have physical therapy in place by a certain date, or it doesn't look like they've met this goal. So they're the ones that kind of, case managers who can be nurses, who are keeping the team on track with helping this client with their care plan. CPCs may be standardized because they're intended to be used with uncomplicated cases, and it can be used as a protocol when clients have problems that we think that we have a pretty specific designated outcome. We can predict it. It doesn't mean that when a case becomes complicated that we can't deviate from a standard, and it doesn't mean that we can always predict a designated outcome. It gives us a template, a format for structuring the plan of care, but it does so it does give us a way to start off and then again case management is individualized for specific patient needs. So when we're applying the nursing process in the psychiatric specialty, what we're trying to do is assist the client to successfully adapt to the stressors in the environment. We're directing the goals to creating changes in their thoughts, feelings, and behaviors that are age appropriate and congruent with their local and cultural norms. And realize that the nurse is a valuable member of the interdisciplinary team, and we're providing a service that is unique and based on sound knowledge of psychopathology, our scope of practice, and the legal implications of our role. So we are not the social worker, we are not the dietitian, we are not the physical therapist. The nurse is its own member, and it has specific ways that the nurse contributes in the ways that follow the nursing process, and our services are unique. We are not just doing little bits of other people's roles. We have our own specific unique role in this process in case management. Concept mapping is a way to use a diagram in order to teach and learn strategies that allow students and faculty to sort of visualize the interrelationships between medical diagnoses, nursing diagnoses, assessment data, and treatment. So it's creating a diagram to show how these things are connected and how we're going to achieve our outcomes. Concept maps are practical, realistic, and time-saving, and utilize critical thinking skills, and they're based on the components of the nursing process. It helps students look at patients' treatment plans in a holistic way to ensure that we're not missing anything and that we're addressing the comprehensive needs of the clients. So documentation of the nursing process. We want to document each of the steps in the nursing process, and remember that documenting is considered evidence when somebody is trying, an investigative agency is trying to determine whether a case of negligence occurred or whether the care was standardized or the protocols were followed. So if we document and we utilize the nursing process to guide our documentation, then we know that we're going to be documenting effectively and appropriately. Documentation is also required by some agencies in order to ensure that they receive their accreditation. And so it's very important that we document accurately and appropriately, and that we're reflecting what we're doing that follows the treatment plan and the nursing process. So there's a couple of different ways that documentation can follow. There's the different types of documentation strategies or formats. So there's the problem-oriented documentation that has a list of problems at its basis. It uses subjective, objective, assessment, plan, intervention, and evaluation as its format. And you might have all heard of that as the SOAP or the SOAPy format. So when you're documenting, you list what the subjective information is regarding this problem, you list the objective information, then you list what your assessment is, then you come up with your plan, then you list what your interventions are going to be, and then you list the evaluation of the interventions. So a really simple example would be the patient just is having pain. And so subjective would be rates pain at 6/10, describes it as sharp and radiating to a certain area of the body. And then the objective data would be grimacing, holding, protecting or guarding the particular area. Your assessment would be that the patient has acute pain, chronic pain, whatever it is that you're determining it is. Then your plan would be to provide the medication administration, let's say, that's been ordered, and to alleviate that pain. And your interventions would be things like to administer the medication and maybe use positioning to assist with it. And then your evaluation would be that the patient is now saying that the pain has diminished, and they rate it at a lower number, and that they're resting comfortably with no evidence of guarding and that kind of thing. So that you would document all of those things in that format, in that order. Focus charting is to choose a focus for documentation, such as a nursing diagnosis, or a client concern or behavior, or a significant change in their status or behavior, or a significant event in the client's therapy. So maybe the focus charting could be describing an outing that a client did and how they behaved on that outing to ensure or to document that provide validation that they were able to utilize some of the strategies that had been put into their plan of care. So let's say that the client was working on preventing or minimizing the number of outbursts that they had in a public setting. And so they went out to a public setting and they didn't have any outbursts. So you would be documenting that that was a significant event in their therapy, that it was successfully achieving that goal. The focus is not a medical diagnosis. It's not saying that the patient, it's not talking about defining some sort of a medical condition. And it uses data, action, and response as the format. So the data would be what you're identifying as the issue that you're charting, and the action would be how you addressed it, and then the response would be whether that action or intervention was effective, the response. The API method is a problem-oriented system. It uses flow sheets as accompanying documentation, and it stands for Assessment, Problem, Intervention, and Evaluation. Most places use the SOAP or SOAPy format, but I do know that some hospitals use the focus charting or the API method. So what you want to do is be confident that you know what specific way they're expecting you to chart in different places, and that you're following the format that they feel is structured for their clients in the best way. So just become familiar with it. I always have my students document what's happened, some sort of an event in their day, and we usually use SOAP, but I do ask them to give me a DAR or a API documentation for something that occurred in their shift, just so that they're aware of other ways you can document and become familiar with these different formats. So electronic documentation is now being utilized by most healthcare facilities, or they're in the process of transitioning to electronic documentation. So they're called EHRs, or electronic health records, and they've been shown to improve quality of client care and efficiency of the healthcare system as opposed to paper charting. The 8 core functions of electronic health records is that this electronic health system should again be more efficient, and so health information and data, it should be more rapid, and you should have a faster access to patient information. It helps you manage the results. It's easier to access computerized test results than to try to look them up in a paper chart. Order entry and order management is more sufficient. Computer-based order entries are safer and more efficient because you're not having somebody write something down and have a problem with misinterpreting somebody's handwriting, or it getting lost because it's not in the place where somebody's looking for it. It helps with decision support. Information support systems enhance clinical performance in a lot of aspects of healthcare. So basically, if you can find the information that you need, you can do your job quicker and better and more safely, because you can make a decision that you might need to be more timely. So for example, if you saw that a critical result came over, you would get that information much more quickly than if we had the lab have to print out the report and then bring it down up to the floor and put it in the chart. All of that stuff really helps us with the decision-making process. Then you know to call the physician and say there's a critical lab value faster. Electronic communication and connectivity, that is improving communication between healthcare providers, and that enhances safety and quality of care. So I'm giving a report to somebody, I have to call them and verbally give it, versus it's already on the chart, it's there, it's accessible, that person can find it and get it, and they have it immediately because it's part of the record. They don't have to go look for it or ask somebody to provide it for them. It's available to everybody at all the same time. It's helpful with patient support. It improves the control of chronic illnesses through computer-based client education, self-testing, and self-monitoring. That means that patients, when they have chronic illnesses, can keep that ongoing record much more current and up to date. It's one of the functions is administrative processes. Its efficiency of the healthcare organization is increased through electronic scheduling systems. So we know a client needs a follow-up test, and that's part of the chart. And this electronic health record can help those be scheduled more efficiently and follow up when they're needed to occur. If we can find out we're missing that follow-up and get it implemented. It also functions as a reporting and population health management. So computer-assisted reporting increases speed and accuracy. I think you're all aware that we tabulate the results of what's going on in the communities as well, and it just helps us identify the management of communities and populations as well. And this slide just goes over the advantages and disadvantages of paper versus electronic health record charting. The advantages of paper was that it was fast, it was portable, and people knew how to use it. So in like the emergency room for a crisis situation, you grab a piece of paper and you just start charting, and it's right there, and you can just document what's happening. The disadvantage is that you could lose that piece of paper. It might be hard to read because of somebody's writing. It's hard to store. It's cumbersome. It's difficult to find what you're looking for. If people are just documenting on pieces of paper, you might be looking at a certain section and it's not really in that section and you aren't sure exactly what section to look into. The advantages of electronic health records are that they can be accessed by a lot of different people. It helps the facilities with their research and with their billing. So it facilitates both of those functions. We can look up a particular issue that we're trying to research, and we can facilitate the billing of the services that were provided, and it reduces errors because, again, the physician is responsible for putting their data in there, and it doesn't get misinterpreted. It gets put in exactly the way they want it to be put in. The orders are much more clear than if they just verbally said to a nurse to give certain medication, or if they documented it and you couldn't read the writing. The disadvantages are that there is an expense to electronic health records. It's a very large, big learning curve for new users, and there are technical difficulties. So I'd say that the learning curve is significant, and if you're going from one type of electronic health record to another, it's not any easier. It's still a big learning curve. So if you're using Epic charting in one facility and then you go to Cerner in another, then you've got to learn that whole different system. And it can take a lot of time to learn that system. It might be that you can input data several different ways, and if you learned one way, you might not realize that there's a better way to do it, or it is cumbersome to learn. And then technical difficulties. There could be a power outage or some sort of a disaster, and then you can't open up the electronic record, or maybe you don't know how to open that particular patient's record because they're telling you that their name is a certain, they got married and they didn't tell you that their maiden name is what their record's under, or maybe you just don't have access to their records by this format. So there's pros and cons, but we are all moving to these electronic health records, and so be prepared to utilize them in your practice. So a couple of practice questions. Which diagnosis is written correctly? You can go ahead and pause it, and then I'll tell you the answer. The answer is C, imbalanced nutrition, less than body requirements related to suspiciousness evidenced by 20 pounds weight loss. Is a correctly written nursing diagnosis. The nutritional problem is documented and the cause of the problem. The underlying the underlying problem is identified, and it's an approved NANDA diagnostic stem. According to the American Nurses Association Standards of Practice for Psychiatric Mental Health Nurses, which specific intervention can be implemented by any psychiatric mental health nurse generalist? The correct answer is A, milieu therapy. It's the scientific structuring of the environment in order to affect behavioral change. It's a nursing intervention that can be implemented by any psychiatric mental health nurse generalist. Psychotherapy, consultation, and prescriptive authority would be advanced practice interventions. Which charting entry is an example of the documentation of a subjective symptom? And the correct answer would be D. I'm seeing green men in my room is a subjective symptom. The temperature, the muscle rigidity, not being evident, and no evidence of drooling, being how the client is behaving, all of those examples are objective data that the nurse is documenting. So I hope you found this PowerPoint informative, and I appreciate your time and attention in viewing it.